Good afternoon. I want to welcome everyone to our weekly COVID-19 update through the Lake Cumberland District Health Department. I'm Tracy Aaron, the Health Education Director, and we have members from our executive staff team here today that will be answering some questions received throughout the week. I'm going to start off, I'll introduce you. I guess Sean Crabtree is our Executive Director, and Stuart Spillman is our Environmental Health Director. And we have Laura Woodrum and Dr. Wayman, who are, I guess Laura Woodrum is our Director of Nursing, and Dr. Wayman is our Medical Director. We also have Emily Tomlinson, who is our Preparedness Manager. And I am going to turn it over to you, Sean, and let you share some updates regarding the past week with COVID-19.
All right, that was on the last couple of video conferences we've had. I've made some general comments about how our role has changed. We started out doing case and contact investigations and issuing isolation and quarantine orders, and we continue to do that. We started out providing public health messaging to social distance and cover your cough, wash your hands, stay 6 feet from others, stay home if you're sick, things. We're still doing that. But we evolved into doing enforcement work for the governor's closure orders for businesses, and for those businesses that stayed open that had to implement social distancing, we started doing those enforcement orders. And then we rolled out to consulting with long-term care facilities on giving them guidance, not just how to prevent COVID-19 from getting into your facility, but what to do if you have a case. We then have started more aggressively working with trying to make sure key people in the community have access to personal protective equipment. Of course, as the governor and the commissioner says, for private citizens and for businesses, medical businesses that are starting to open up, you still have to get your PPE through standard channels. But we're still working with the high-risk groups, or the primary responders like hospitals, nursing homes, and so forth. We're getting ready to evolve into managing testing in our district a little bit more, trying to make sure we have access to test kits, and all of the medical facilities that want to provide testing can get in on that. So our role as a health department keeps changing. Right now we have experienced 175 cases total in our district. Of those, 15 are presently in the hospital, 53 are on self-isolation, for a total of 68 current active cases. That means of the 175, 92 have been released from isolation, meaning they've been symptom-free long enough, they're no longer of concern, and of course we've had 15 deaths in our district. So that's sort of where we are. Tracy, you're muted if you're trying to talk.
Thank you, Sean. Okay, so I'm going to start with some questions, but I do want to remind anyone that's watching YouTube Live that you can go to the chat box and type in questions at any time, and we'll answer those throughout the call. The first question is for you, Sean. Kentucky and Tennessee COVID-19 deaths are almost identical, yet Tennessee has tested over 100,000, while Kentucky test numbers are somewhere around 33,000. Why has Tennessee been able to test 3 times more the number of cases as Kentucky, and are the total numbers likely very similar to Tennessee given the testing differences?
Now that's a kind of a tricky question. When I looked on the state website this morning, Kentucky had tested 52,511, and that's their best guess, taking into account the state lab tests, and of course they have an agreement with Gravity Labs that provides them accurate testing information. But there's a lot of these pop-up labs where we're not entirely sure how many tests are happening, but Kentucky's best guess is 52,511 this morning. Assuming Tennessee has the same kinds of challenges we have. Let's just say Kentucky has tested, we'll round down 50,000 people, and Tennessee's tested 100,000. Well, when you look at Kentucky has a population of 4,468,000. Tennessee has a population of 6,829,000. So as a proportion of the population, Kentucky has tested 1.12% of its total population, and Tennessee has tested 1.46%. So even though it looks like Tennessee has tested a whole lot more people, proportionally they really aren't that much ahead of Kentucky in terms of testing. So neither state can say they have really aggressively tested a large percentage of their population. I know each day the governor talks about testing hundreds or even thousands of people, but we're talking about millions in the population, so there's still a lot of room to expand testing. I can't speak exactly to Tennessee's testing circumstances. I certainly don't follow Tennessee as closely as I do Kentucky. I was looking on the one of the websites today that track cases and deaths by state, and I noticed Kentucky had its first case 3 days earlier than Tennessee. So all of these statistics I'm going to mention just now, remember 3 days, Kentucky was 3 days ahead of Tennessee. So as of 4/28, when I started looking at this yesterday, Kentucky had 930 cases per 100,000. Tennessee had 1,451 cases per 100,000. So Kentucky is doing a little bit better than Tennessee as far as cases per 100,000. Kentucky and Tennessee both, their growth rate was 1.05, meaning that for each state, the days for confirmed, cumulative confirmed cases to double is now at 15. A couple of weeks ago when I looked at it, that was doubling about every 4 days. So both states have made considerable progress as far as how quickly the number of total known cumulative cases is doubling. Kentucky, our death rate has been 47 people per 100,000. Tennessee's death rate was yesterday 26 or almost 27 per 100,000. So Kentucky 47.7, Tennessee 26.9. So it sounds like, as far as the mortality rate, Kentucky is doing considerably in a considerably more difficult spot than Tennessee. But I looked at every state in our nation, all 50 states in the District of Columbia, and Kentucky's mortality rate in the nation, we were 11th highest out of 50 states in the District of Columbia. But the national average, the rate is 5.17. So we're actually at our mortality rate of 5.14. We're a little lower than the national average as far as our mortality rate. So, I'm not sure that Tennessee's just maybe doing exceptionally well, but Kentucky's doing a little bit better than national averages. So I hope that helps to put this in perspective.
Okay, thank you, Sean. Next question is for you, Stuart. In Adair County, since Adair County is included in the Lake Cumberland district, many are concerned and watching closely the hotspot, Summit Manor, because there's a lot of local people who live and work there, and it's very close to Russell County. I have been hearing for several weeks that the positive cases were much more than what is being reported through Frankfort. For instance, they reported yesterday that they had 78 cases with 9 released and 9 deaths. They went on to say that they currently have 60 active cases, with 48 of them in home or at Summit Manor nursing home isolation and 12 in area hospitals. However, the governor's report never gives a report of that many. There's a difference there. I know it takes several days for the information to flow to Frankfort, but this has been public knowledge for several weeks now.
All right, Stuart's pointing at me. I think he wants me to answer it, so I'm gonna take this. First, I want to say our hearts and our prayers go out to Summit Manor. They've been hard hit. They've not been the hardest hit long-term care facility in the state. There are several that have been hit harder, if that's possible to believe. You can look at the Kentucky COVID-19 website, and there's a couple different maps there. One is the total cases experienced, and one is it breaks it down as how many per 100,000. And you can see Adair is one of the counties that's shaded more dark, which means it's been harder hit, but there are several places in the state that's been hit harder, and that has to do with long-term care facilities. But, you know, Summit Manor is in Adair County, and that's our home, in our home district, and we care about everybody, but we particularly care about our local people. I know it's been a difficult situation. As far as the question goes, what Summit Manor reports each day is a daily set of circumstances. The governor's never going to report the daily circumstances at each of these long-term care facilities. He just gives statewide cumulative counts and some statistics. So the information that the governor uses is on the Kentucky COVID-19 website. If you scroll down through there, there's a link to, let me see if I can find that so I can tell you exactly where it is. It'll take me just a second to get to it. I'm navigating to this from our website, by the way. I go to our homepage and I the COVID-19 banner, and then I go to updated resources and guidance, and I click the Kentucky site. So I'm on the Kentucky COVID-19 kentucky.gov site, and I'm scrolling down, and there's a couple of different links. One right under the green box, there's a long-term care facility update, and you can click that, and that gives you the numbers for all the long-term care facilities in the entire state. And of course, this is part of the governor's site. He's the governor over the Cabinet of Health and Family Services and the Department of Public Health. So this is a Department of Public Health site, but they're the ones that provide the information to the governor. And then if you go on down, there's a interactive map option where you can click desktop dashboard. And when you click that, it shows an interactive map, but one of the things it has on that interactive map, it has confirmed cases by county. And it's got county totals, and when I looked at this last night, the Adair County totals was consistent on this information that the governor would have given. They wouldn't given all this at once. They would have given part of it one day, and then as more cases were added, he'd given more of it the next day, and as more cases were added, he would have given more of it the next day, and so forth. But the total cumulative count was accurate. So I'm not exactly sure about the question. I don't think the governor maybe reports the information in the way people are expecting to hear it, but the information he has reported and is reflected on their website is accurate. So I invite everyone that's listening in to go to the Kentucky COVID-19 website and use those links, and you can read about the situation in all the long-term care facilities and the situation statewide.
And I might add, we'll put that link in with the minutes or with the questions on our website following the meeting today.
I can put it in our chat box. I'll put a couple of links in there right now.
All right. Thank you, Sean. Next question is about yard sales. Who would address and answer the questions concerning having yard sales? Are we allowed to have those now? Stuart?
Oh, yard sales are still not permitted. We're waiting for guidance from the governor's office to let us know as things start loosening up when those will be permitted. But as of right now, yard sales are not approved.
Okay, thank you. So the next question, it's asking, what is the plan for businesses? And this is talking about in Russell County, but I guess we could think about it all of our 10 counties. Is there a plan for businesses opening up, and who's going to monitor that?
Businesses can already submit their plans to The governor's office, go on the KY COVID-19.gov website. They're able to submit their plans. Right now, we know that we have a phased opening of healthcare. That at this point is all that we have guidance for, but any plan, whether it's Russell or any of our other counties, any other types of business other than the healthcare that is opening right now, we will wait and we will follow that governor's office phased guidance for reopening, and then we'll monitor those businesses for any types of non-compliance issues, and we'll also be here to help guide them along the way too, to open in a safe manner.
Okay, so did I also hear you say, Stuart, that they can propose a business plan and put it on the governor's website?
They can do that. There is a link on the KY COVID-19 website.
All right. And we'll put that in the minutes also, just so everyone will have access to that. Next question. Thank you, Stuart. What is the plan for testing? And this says Russell specifically. Will they be doing? Will they be available to test for everyone, and when? And is there something that the health departments will do? So I guess we could look at that. Maybe all of our counties. This one does say specifically Russell, but Dr. Wayman, I'm going to let you answer that, please.
Okay, so testing for COVID-19 is most accurate when it is performed on people who actually have symptoms. If we test everyone who is symptomatic or asymptomatic, you will have a lot of false positive results. We and the Department of Health are currently working on a program to provide testing kits to the medical providers in all of our counties. Hopefully this will happen in the next couple of weeks, and this will dramatically increase the capacity.
Okay, wonderful. Thank you, Dr. Wayman. So I think that maybe answers the next question too. When will there be tests to see if members of the community have been exposed to the virus? No, that doesn't, and they have built up immunity. I'm sorry. And when will that be available locally?
That is already available through the lab call. That is, your private provider can send the test off for antibodies. However, this test has an emergency approval by the FDA, which means you can use it, but it hasn't really been validated because we haven't done enough testing. So we can use it to assess perhaps the exposure within the community. We're not entirely sure whether an individual's test will be very accurate for their immunity. It can cross-react with other coronaviruses, such as the common cold. So it's a difficult thing to assess, but it's available.
Okay, thank you, Dr. Wayman. The next question has to do with compliance, and I think this might be yours, Stuart. Is there an update on an individual from Macquarie County who refused to self-isolate or get tested after complying and being in contact with someone with COVID-19?
We've been able to contact that individual now, and we've been able to relay the guidance to them.
Okay. Thank you, Stuart. Next question. Governor Beshear has indicated that masks will be required and wearing those for anyone who goes out in the public when they open up again. Will the health department play a role in enforcing that and making sure businesses and individuals are compliant?
We're still going to await some guidance on that, on what that will actually look like as far as the employees of businesses and then the patrons of that business. But yes, we would be involved in, again, Just like the opening of the businesses, we will help them with any plans they may need help with, and then we would be able to monitor any non-compliant situations that might arise from that.
And businesses are permitted, so, any facility that's permitted, the government can regulate and oversee that. And, I know the Department of Labor is doing some of that, and the local health departments is doing some of that. Now, we can enforce that on any permitted facility. As far as individuals wearing masks, we will, like everyone else, watch the governor's updates and see just how far that will go. I'll remind everyone, if you've got questions, to put them in the chat box. I do see one, Tracy. I'm going to go ahead and read it while I've got my mind on it. It says, are there tests available for Clinton County? There is tests in each county. There's places you can get tested. I know we have an arrangement with Gravity, or there is an arrangement with the Gravity Labs in each county. The testing criteria, I don't know, Laura, where's the location in Clinton and what's the testing criteria?
Well, that changes often, but they can check with their local healthcare provider to see if they are providing testing. We offered that to the providers in Clinton County, and most of them are getting tests from their local hospital.
Okay. All right. So we were still trying to test either first responders and symptomatic. The testing's not open broadly yet.
There's a tiered approach to testing, and it's how healthcare providers interpret that guidance and choose whether to test or yes.
Okay, thank you, Laura. Next question. Signature Healthcare released a media statement yesterday. And so there's some questions around that media statement where they made reference to the health departments. It says Signature said that employees who are tested positive were not allowed to return to work without the approval from the health department. There has been reports at different Signature facilities that employees returned to work after 1 week of no symptoms, but a negative test was required. What standards has been required for approval by the health department for employees to return to work after testing positive or becoming ill?
For all workers, not just long-term care workers, but for all workers, at least 3 days or 72 hours have passed since recovery, and that's defined as the resolution of fever or without the use of fever-reducing medication, improvement of respiratory symptoms and other symptoms, such as cough, shortness of breath, diarrhea. At least 10 days have passed since symptoms first appeared, and it was recently changed from 7 days. It was 7 days, and now it's 10 days. And for healthcare workers, a one-time negative COVID PCR test.
So as you can see, the guidance that we use, it evolves over time. So it's not surprising that there's different information about, how people are asked to return. We look to the Centers for Disease Control and the State Department for Public Health for our guidance, and that guidance is still evolving. This, all of our knowledge about this particular disease is still evolving. It's a novel virus. It's a novel disease. It's new, so we're still learning about it. And the experts at the Centers for Disease Control and the State Department of Public Health, their guidance is changing as they understand it differently. So that's just the nature of a new illness.
And I understand Signature has a hotline if you have specific questions for them or concerns in that community, and that's 1-888-392-8886, and it's a 24-hour line, is my understanding, if there are specific questions or concerns related to Signature.
Okay, and we'll add that number to the information from the questions. Thank you, Laura.
Mm-hmm.
I have another question regarding the media release from yesterday also. It said signatures released reports about the facility making the decision to test all residents, which is non-commendable. It also states that they followed federal and state guidelines as far as PPE concerns. Does the health department have a timeline of when PPEs were used by the employees?
Many individuals who contract the virus are often asymptomatic without symptoms. Therefore, it's impossible to know when the virus began in that or any facility. We do know that some at Manor and other long-term care facilities throughout our district began restricting visitors and followed the governor's order, which I think was on March 10th. Again, if there's specific concerns for Summit Manor or their procedures, I encourage people to call that hotline.
Okay, so I think within that it says, do you know what procedures were put in place? And I think you just referenced those in regards to the governor's orders on March 10th, restricting visitors. Right. Okay. That is all the questions I have. Sean, are there any more on YouTube Live that you're seeing?
There's one more, an employee at the health department there in Clinton County says Clinton Family Medical is testing in Clinton County, and so is the hospital. So I assume that's accurate information.
Okay.
If anyone else wants to type a question in, I'm watching the live chat box on YouTube. I see we've had up to 70 plus people watching it live. And if any of you want to post something, feel free.
And also, Amy, I don't see you answering any questions today, but do you have any updates you want to share?
No, I'm good, Tracy. Thank you.
You're muted, by the way. Oh, no, you weren't. You had this mic, didn't you? Yeah, never mind. She was not muted. That's my fault.
Does anyone else have any comments they want to share?
All right. The final thing I will say is before we thank you all for attending and caring about this and helping us to help the communities by observing the social distancing. We do understand that there will have to be a considerable amount of additional testing done in order to meet some of the governor's guidelines. So, we are, I remind you, working on becoming a testing management center, which means that we will get some testing supplies at each health department. While we won't necessarily be doing the testing, we will be pushing that out to local medical providers that want to do the testing. As insofar as supplies last, there's still a limited amount of supplies, but whatever supplies we get, our intention is to push those out. I know there's already some testing supplies that are flowing into some of our area hospitals and being pushed out to local sites. So, we will do the best we can with that with the supplies that are available.
Sean, I have one more question. I'm sorry.
All right.
It says, do you know how many people have tested positive in the other counties compared to how many's tested positive in Adair County? Wondering, I guess they're wondering if the higher number of positive cases is due to more people having been tested.
Adair County, the reason why Adair County stands out beyond all the other counties is because they had the outbreak in the personal care home or in the nursing home, and the corporate management of that nursing home was able to secure testing and tested everyone in the site. Even in nursing homes and other nursing homes across the state, they haven't necessarily used that strategy of testing everyone. Instead, they've monitored for symptoms and treated people as if they were positive if they were symptomatic without necessarily testing them. But they did do the testing, so we have more confirmed cases in Adair County.
12 of them are asymptomatic.
And currently, 12 of those cases are still asymptomatic, not showing any symptoms. So that's one of the things that makes this such a difficult disease to deal with. You can have it and be spreading it without knowing you have it. Our other, our largest, I don't know if it's largest as far as percent of population, but the next as far as raw numbers is Pulaski County. And we know we had a significant exposure in a local church, and then some of those exposures moved into some businesses and things. So that was kind of the situation there. But our district, if you look at our website, and I posted that in the comments on the YouTube Live, there's a graph, a trend graph on our particular COVID-19 page that shows how our district is trending compared to the state. And if you look at the national numbers, you will see that Kentucky is doing very well compared to the national average as far as confirmed cases. And you will see that Lake Cumberland is doing very well in the state as far as confirmed cases. So Kentucky is one of the better states, and Lake Cumberland is one of the better places in the state. So, relatively, we're doing pretty well. Now, there is an outlier, but as district-wide, which I wouldn't recommend using the results from any single county for your analysis, because it's not a large enough sample size. So definitely look at how we're doing district-wide. We have a population of 208,000 district-wide, which is about a fifth of the state's population, roughly. So that gives us a pretty good sample size. And as a district, we're doing a little better than state average, and our state's doing better than national averages. So that's good news for us.
Okay, thank you, Sean.
I think one closing thought, we're all going to keep a watchful eye on some of these states that are rolling things up faster than Kentucky is, to see if they have a big spike. If they have a big spike in cases and start overwhelming the hospitals, we'll know that that's not the way to go. And if they don't, then maybe the governor will see fit to roll Kentucky up quicker. So we've all got a watchful eye on these states that are being the first ones to start opening things back up. So just like everyone else, we're in a hurry for this to conclude and for things to move on, and maybe we will arrive there in a few months.
All right, thank you, Sean. And thank you all for joining today. If you have questions, I encourage you to send those into the district, and we hope to see you next week on our call.
Thank you all.